Thanks very much, Oliver. Somewhat overstated. And thanks very much for the welcome, and thanks to Leisha for the welcome as well. As Leisha said, the Minister who had planned to be here at short notice faced an opposition motion on the trolley crisis, so he has to be in the Dáil tonight. He sends his best wishes. I appreciate that as a stand-in, I lack some of his considerable appeal, and I'm grateful to you all for not wearing your disappointment openly on your faces. In pharma terms, I thought if the Minister's a blockbuster, I'm probably not even a wordy generic. Without straining that comparison too much, I think if we did a fairly interesting study on the active ingredients of a very successful politician and a career-grade civil servant, although we have very complementary roles, we probably have very little overlap in terms of active ingredients. In any event, due to the unexpected circumstances, I'm delighted to get the opportunity to say a few words to you and to talk a little bit, as Leisha has invited me to do, around the partnerships between the Department and IPHA, and the Department, IPHA and the member companies. I know you'll be terribly disappointed if I don't spend time highlighting the requirement to achieve affordability and sustainability in the drug supply chain. So I will return to that. But before I do, I just wanted to say one or two things on some other areas. The Department has policy responsibility for the regulation of medicines, and we obviously do that in conjunction with our EU colleagues. We rely for our operational day-to-day discharge of that on the Health Products Regulatory Authority, which is an independent body under the aegis of the Department and represented here tonight by Michael as chair. Protecting public health is the foremost concern of the HPRA, but it does this in a manner that delivers an effective and efficient regulatory framework and which facilitates timely availability of appropriate health products. The authority's continuing and successful development of its capability to meet evolving regulatory requirements is important in a sector which is moving as rapidly as yours. And I think it's borne out by both national and international opinion that the HPRA is recognised as doing a very good job in this area. I also wanted to say a few words on health research because, as Oliver has mentioned, it's been something of a hobby horse of mine for a while. And many of you are at the forefront of using R&D to try and bring forward new products and new processes. The health service is a very complex service made up of 100,000 people, many of who are very skilled health professionals, delivering a comprehensive and complex range of interventions, often with potentially very major consequences, mostly very, very positive consequences. But as a knowledge-intensive industry, it's absolutely essential that R&D is at the heart of service delivery within the health services, and I don't think that has been sufficiently recognised in the evolution of our health services to date. I was very happy to see IPHA's pre-budget submission, where you put forward your strong support for trying to further develop Ireland's clinical research environment. And I've noted what Leisha had to say about the clinical trials situation, and it is an area of priority that we will seek further to address. Some good work has been done in the past on trying to map out what an excellent clinical research environment might look like, and that in particular was brought together in an action plan for health research. Unfortunately, the financial crisis intervened and has taken up a lot of time and a lot of attention. But I want to pay a special tribute to Graham Love and his colleagues in the Health Research Board who, despite that crisis, have continued to push on with trying to make our health research environment a better one. Particularly, I'd highlight the success with which they've had in delivering clinical research facilities on our major hospital campuses and the work that they are currently engaged in trying to put in place clinical trials networks across a broader range of disease areas. Our very recent appointment in the Department of Maurice O'Connor as Assistant Secretary General in charge of R&D and health analytics, I think equips the department to take its rightful place in trying to provide further leadership in this area. Maurish's previous role was in the Higher Education Authority, and he will work with the HRB, with the health services, with enterprise, and with the research community to try and realise the vision that's set out in the Action Plan for Health Research. Research is one element of our overall efforts as a department to support improvements in health and well-being. The Healthy Ireland initiative provides a very important contribution to that overall goal. We recently launched the Healthy Ireland survey, and I think that research provides us with some very valuable information about the nation's health. The survey gives us some reasons to be optimistic. You wouldn't always hear it on the airwaves, but we do have some reasons to be optimistic when it comes to health. Most people take some form of exercise and eat fresh fruit and vegetables every day. While these are positives, it's also clear that we need to make improvements in many areas. For example, only 1 in 3 people are sufficiently active. We have made great progress in smoking, and now we need to make similar progress in areas such as alcohol, obesity, and physical activity. In keeping with the spirit of Healthy Ireland, it will only be possible to do that with the broadest range of actors, and it goes well beyond the health sector and certainly well beyond the Department of Health. You are in the business of health, so the nation's health profile is not news to you. But you're also large employers, very large employers, with 24,000 people directly employed in the industry. And under the Healthy Ireland initiative, we are interested in working with employers to promote healthy workplaces. We would be very happy to work with you to try and explore how we might do that, if that is something you're interested in working with us on. In terms of the health services, as has been mentioned by Leisha, we've been through a number of very difficult years, probably the most difficult in modern times, given the length of the recession. Between 2008 and 2011, £1.5 billion was taken out of the health budget, and the budget remained flat until last year, when we secured the first increase in 7 years. And this year we secured a further £880 million on the 2015 budget, bringing spending to £13 billion for the first time since the economic crash. Although this may sound like a lot of money, and it is a lot of money, it will only stretch so far given the pressures the health service is under. We can predict increasing demands into the future through demographic pressures, a growing and ageing population, and increase in chronic illness. The EU fiscal rules are designed to avoid the boom and bust in public finances, which, as we know only too well as a country, have been a source of a lot of our problems. The rules place constraints on the rate of growth in public spending, and since health is a quarter of that total of public spending, that overall constraint is likely to have direct implications for the rate of growth in health spending. Your pre-budget submission recommended that health spending should grow as a proportion of GDP, and as a Secretary General of the Department of Health, I could only nod at that. However, it will be difficult to achieve. Overall expenditure is firmly pegged now to underlying economic growth. And indeed, the measure of economic performance, which is used to calculate that, is not nominal growth in GDP. It is based on an estimate of the sustainable growth path of the economy. And in terms of where we're at currently in the economic cycle, that calculation of the sustainable growth path is likely to be significantly below the headline growth in GDP that we see over the coming years. We also have to provide for the urgent requirement to reduce public debt levels towards more sustainable levels. So while if the Minister, if he was here, and certainly I can say, we will be putting forward the strongest case possible for increase in health spending, we also have to be realistic in recognising the overall constraints facing the Exchequer. So I won't labour the point on the various different calculations that can be made, but if you were to ask me to look forward, I think it's based, hopefully, in its best case scenario, as one of modest increase in health spending. And whatever those budgetary prospects, there will continue to be very, very many calls on our limited health resources. The problems are rehearsed so often that I don't need to do so here, but many of them present us with competing demands for our available resources. In overall strategic terms, in order to address current and projected needs within what is affordable, it is necessary to reshape how services are delivered. In some exceptional cases, priority areas will see extra resources, whether current or capital, but this will not be the norm. In many areas, the challenge will be to get more for less. I am very aware that the pharmaceutical industry has faced its own challenges, which have been referred to, and I want to acknowledge the significant contribution that your industry has made to the Irish economy. The scale of this is apparent when one realises that annual exports of pharmaceuticals are over 50 billion euros, making Ireland the largest net exporter of medicines in the European Union and representing over 50% of the country's total exports. The government greatly values the pharmaceutical industry's ongoing contribution to the economy in terms of investment, in terms of jobs, in terms of exports, as well as its contribution to the health services. I have had the opportunity to visit major pharmaceutical operations in Ireland, and one could not but be impressed by the quality of the management in your sector. I have no doubt that this has been absolutely key to Ireland's competitive success in winning business internationally. There is much indeed, I think, that the wider health sector can learn from the quality of your leadership and your operations. I did promise I'd say something about drug supply reform, so I won't disappoint you. The range of medicines on the market, as Leisha has outlined, is becoming increasingly more complex, more specialised and more expensive. The number of drugs arriving onto the market has risen exponentially in recent years. Advances have been remarkable, and today there are literally thousands of medicines on the market. Understandably, patients and clinicians are keen to have access to the newest and the most innovative medicines. But the high costs that are often attached to new high-tech drugs represent an additional call on a health budget with many other competing demands, as I've just referred to. Public expenditure on drugs provided to patients under the community drug schemes in Ireland has increased rapidly over the past decade, with year-on-year increase in spending on medicines being amongst the highest in Europe. In 1998, we spent just under 400 million on medicines, but by 2014, this figure had risen to around 1.8 billion, in the region now of about 15% of the overall health budget. State spending on drugs and medicines must deliver real and tangible value for the taxpayer, while prioritising health outcomes, patient safety, and continuity of supply. The state is fully prepared to pay for necessary treatment and ensure that patients get the therapy they need, but only at a cost that represents value for money for the taxpayer. Ireland's financing model for drugs needs to be both sustainable and affordable. As we know, the state has introduced a series of reforms in recent years to reduce pharmaceutical prices and expenditure, and these have resulted in reductions in the prices of thousands of medicines, and they have also created headroom for new medicines to be made available to the Irish public. However, despite our achievements to date, further reform of pharmaceutical supply, prescribing and dispensing remains an important part of the overall health reform process. The Department of Health and the HSE are therefore engaged in an ongoing evaluation of the drug supply chain to maximise value for money and the state's drug bill. Central to these measures have been the state's agreements with industry on the pricing and supply of drugs. The most recent agreement with IPHA in 2012 has generated more than 400 million in savings, by which I mean costs that the health service would otherwise have had to bear. The positive outcomes of this deal for the state were significant reductions for patients in the costs of drugs, a lowering of the state's drugs bill, timely access for patients to new cutting-edge drugs for certain conditions, and reducing the cost of the health service into the future. The agreement has allowed the state to achieve greater value for money without compromising the continuity and security of supply. It has helped to release some much-needed resources for new therapies while continuing to encourage innovation that is so important in your industry. It has also provided a planning framework within which business can be conducted by the industry. Our own analysis of the current agreement is that, in line with expectations, it produced very significant savings, although the cost of introducing new therapies over the life of the deal exceeded that provided for in the agreement. there is arguably insufficient public awareness of the funding being provided by Irish taxpayers for new drugs. In recent days, as I've looked, just to show you that I keep in touch with social media, as I looked and saw that Pamela Anderson has announced her success in her treatment for hepatitis C with new innovative drug therapies, it occurred to me that these very same therapies are now being rolled out in Ireland under a multi-million euro early access programme that is based on clinical priority rather than ability to pay. The limited debate on new drugs tends to focus on those treatments which we have not yet introduced, rather than those that are being successfully funded at considerable cost to the taxpayer. And as an aside, I might just proudly remark on the fact that I think I am probably the first and only Secretary-General to ever manage to mention Pamela Anderson in a speech. You thought that civil servants weren't known for breaking new ground. In any event, it is likely that innovative, high-tech drugs will continue to grow their share of the overall drugs market. It is up to both government and industry to ensure that such drugs can be made available at a reasonable cost to the people who need them. We need to work towards a successor to the 2012 agreement, and relevant officials in the department are working with colleagues in other government departments and the HSE to prepare for negotiations with IPHA, which I hope will take place in the coming weeks. I know that your association is anxious to engage in this process, and I look forward to a constructive and realistic engagement that will result in a mutually acceptable outcome. The 2011 programme for government included a commitment that reference pricing and greater use of generics will be introduced to reduce the state's large drug bill and the cost to individuals of their medicines. And we were successful through the Health Pricing and Supply of Goods Act 2013 in introducing a system of generic substitution and reference pricing. Reference pricing has been a key lever in reducing the cost of drugs, and it has delivered savings of over 47 million in 2014 and further savings of 25 million expected in the current year. Another important initiative to address the cost of drugs is the HSE's Medicines Management Programme. And a key element of the programme is to focus on cost-effective prescribing and the reduction in expenditure through more rational prescribing. The introduction of a preferred drugs initiative and the extensive use of health technology assessments are essential to the achievement of the programme's objectives. In conclusion, the government is strongly of the view that the current and potential future cost of pharmacy services under the GMS and community drug schemes is not sustainable in the context of increasing demand due to demographic issues, increasing levels of chronic illness, and the increasing expectations of patients. It behoves all of us to address ourselves to this major challenge, for the Irish Health Service, for the taxpayer, and for industry, so that we can establish a sustainable approach into at least the medium term. I want to acknowledge again the contribution of the industry to reducing the cost of drugs in Ireland by implementing successive pricing and supply agreements. I look forward to our forthcoming engagement, and I hope that in a spirit of partnership it can produce a workable outcome. Finally, to thank you for inviting me to the dinner, and I hope you enjoy the rest of the evening. Thank you.